Hey everybody, it's Friday again. That means the doctor's in live with TOA. This is it. I'm Stahlman. I'm your host, and welcome back. For those of you who are new, welcome aboard. I hope you guys find this informational series helpful to you, interesting, a little bit fun maybe, but please, we rely on your feedback to help us make these programs useful for you. So if you have a topic of interest, if you have questions, you can contact us in the comments below on Facebook or YouTube. You can email me, Dr. Stahlman Online, that's DrStahlmanonline.com. That's info@drstahlmanonline.com. Or you can go to the website, TOA.com, and you can learn some things about TOA, Tennessee Orthopedic Alliance, the Middle Tennessee's largest and oldest musculoskeletal care practice. You can learn about our physicians, our offices, and whatnot. So please, let us hear from you. Good, bad, indifferent. We would love to make sure we keep improving things so that you enjoy what we're doing. Anyway, so today I hope everybody's staying safe and healthy. Still weird times. We still don't know a lot, and we don't know what's going to happen. Unfortunately, as I've been telling folks, we won't know what happened until it happened. But please stay safe out there, be smart, use some common sense. It is an infectious disease that we don't have control over, and the good news is fortunately it looks like it's probably not as widespread, serious as far as deadly to a majority of the population, but it clearly, when those people get sick, they get really sick, and we still don't understand why. So again, be smart. TOA continues to practice utilizing the CDC guidelines and the state and local government guidelines regarding social distancing, mask wear, pre-screening coming into the clinic and whatnot, and that again is for your safety and the safety of our staff. So please be patient, be kind to one another, and we'll all get through this. So I was talking to a friend of mine on a bike ride the other day, and he and I have known each other for a very long time. We're about the same age, and he was asking me questions about an upcoming surgery that he was having. He's had a hip problem for many years, and he was planning to have a hip replacement. And he was talking to me about his surgeon of choice and that type of thing. And I was asking him how he came to come under the care of that particular physician. And I got to thinking about what patients kind of have to come to grips with when they're choosing an orthopedic surgeon, especially if they're going to have surgery. And so I thought that would be a good topic to kind of talk about, kind of give you some information about what some of the buzzwords are, what things mean, and one way, my opinion, about how to go about approaching finding a surgeon for your needs. So let's talk a little bit about that. So it used to be, when I first started in practice 25 years ago, and certainly earlier than that, how someone got sent to an orthopedic surgeon was almost always coming from your primary care doctor. Basically, you had a problem, your doctor would send you to the physician that he felt was appropriate for you. In many communities, or particularly 25 or 30 years ago or longer, there were no such things as subspecialty orthopedic surgeons. Everybody was what's called a general orthopedic surgeon. That means that basically all the physicians did a little bit of everything. Some people, they would take care of low back pain and a broken ankle and a sprained wrist and carpal tunnel syndrome, and they do all these various things. Well, when I came through training, it really became much more frequent to see subspecialty training. So I'm trained in the specialty of orthopedic surgery and the subspecialty of spinal surgery. And so we branched out into more and more specialized care. So In this day and age, we see a lot of people, in fact, most people coming out of training go through fellowship training, at least in the bigger cities, and they specialize in things like joint replacement or pediatric orthopedics or spine surgery, in my example, hand surgery, foot and ankle surgery, sports medicine, these types of things. TOA still has some general orthopedic surgeons, and they're very good physicians, but the way things have moved over the years, the subspecialty care is really what has come about, and frankly, that's what most patients are really seeking. So when I first started, and it was predominantly general orthopedists, your primary care doctor would send you to the doctor, and that orthopedic surgeon would do what he could, and if for whatever reason he or she didn't feel comfortable with a particular problem, might send you to one of their partners or colleagues who had a bigger interest in that problem. Nowadays, insurance companies don't necessarily require you to have a referral from your primary care doctor. And in fact, in many cases, people can just pick up the phone and call any physician's practice that's in their network and make an appointment themselves. And so a lot of times what we'll see, particularly in the day of the internet, is people will look online and say, okay, here's orthopedic surgery, I have a low back pain problem, here's spine, or neurosurgery, and they'll make an appointment. And that gets you more to the specialist more quickly, but there are some other ramifications that you have to think about, particularly if you're working on choosing somebody to actually work with you on a surgical treatment for your problem, okay? So not every single doctor is built the same way. Not every single subspecialist agrees on the same strategies. And there are different approaches to a similar problem. I tell patients all the time, there's lots of different ways of skinning the same cat in the orthopedic world. And so it really depends a lot on our training or our philosophies or our opinions about the information that's out there in the data. So we go from patients just going to the doctor that their primary doctor sends them to patients being able to choose somebody on their own. I think it's really important for people to understand that reputations of physicians, quality of physicians, particularly with surgical experience and outcome, is very personal. And there are, just like everybody in the world, there are people who you like, there are people who you get along with, there are people you don't care for so much or you don't get along with. Now, somebody who you don't care for or who you don't get along with, that doesn't mean that they're a bad surgeon. But because most of what we do in orthopedics is elective, meaning you have the choice of doing surgery or not, most of our cases are not emergency problems where you don't have much of a choice. It's not a life and death situation. There are a few things that come close, but the primary role of orthopedics is functional restoration, which is a lifestyle choice. And so you have the ability, and you have, frankly, the responsibility to yourself to not just go where somebody tells you. You have to use your own experience and gut to determine if it's a good fit for you with what that person is saying and how they do things. So it's completely valid for you if somebody you've seen says, I think you need surgery and this is what I would do. It's completely valid and appropriate for you to ask questions about that to satisfy your own curiosity and interest. It also is extremely appropriate to get another opinion. As I said, a lot of physicians have differing opinions about how to skin that cat, and you may find somebody else that approaches things in a little bit different way that appeals to you. Now, what would make those decisions? Well, most people don't really have much insight into the technical details of a surgery, such as what type of approach the surgeon will use or what type of hardware the surgeon will use. But not only is the surgery an important part of the whole care and recovery, but the preoperative and postoperative management of that patient is important too. And so if you're dealing with somebody who you can't communicate with, who you don't feel like is listening to you and your problems, that's probably not the best fit, even if they're the best surgeon in the world. So it's important for you to really take ownership of that part of the analysis of deciding when and by whom you're going to have surgery with, because it really is a partnership, okay? Surgeons really rely on patients to play the game with them, if you will. It's important for the best outcomes for patients to be able to understand, listen to, and follow instructions that the surgeons give them. Each surgeon kind of has a different set of instructions and how they approach things. And it's the best outcomes come when the surgeon and the patient are on the same page and they work together toward the solution. A lot of people these days in the era of social media look to the internet for reviews. So Yelp, TripAdvisor if you're traveling, Google, and then the medical review sites such as Vitals or Health Grades, these types of websites that are repositories for people's opinions. I'm going to caution you a little bit about looking at the reviews. And the reason why is just because some doctor has 1 star or 5 stars from a specific individual does not mean that that person may not be right for you. It also doesn't mean that that doctor is necessarily a bad doctor. We've found that many times when a review is left, particularly a bad review, it's because the patient is dissatisfied in some way. Now, it could be legitimately something went wrong, I wasn't told this, I was treated poorly. That's true. But there are also times when the whole experience has been based on some bias that none of us know about that patient has. I've seen many times on doctors' reviews where they have lots of glowing reviews and then a terrible review, and if you really read the review, it's because the patient had to wait 15 minutes in the office before the doctor saw them, or something like that. And so it doesn't necessarily mean that that person is not right for you. In addition, some of these sites really don't play fair. There are sites that have reviews that are essentially paid for, okay? So you can have people who are professional reviewers writing good or bad about specific physicians, and that's not really an unbiased opinion. That's a purchased service by that website. In addition, there are some websites that do not do any type of surveillance of bogus or inflammatory or negative reviews that have no basis. And so we have to be careful about those types of sites. The other side is physicians. If one of the strategies that any business can do is flood that reviewing site with nothing but positive reviews. So they get their friends and family and relatives and church members and everything writing a review, or they just write them under different names. And because they're not monitored, all of a sudden a huge listing that's all positive reviews kind of, not dissolves, but decreases the concentration of the bad reviews. Sorry, I'm losing my mind. And so we're a little cautious about looking at one specific review, good or bad. I think the overall gestalt about reviews can be helpful in some ways, but you have to be very careful about that information because that type of information is not verified. And so that is one of the negatives of social media and review sites, is that we really don't know the truth of that experience. And so I would be very cautious to just look at that and say, oh, well, this is bad, therefore he must be a bad doctor, and I'll spread that information around other places, because it may very well not be true. So we've talked about getting into the doctor. We've talked about talking to the doctor, asking questions, being your own advocate, or if it's a family member or a younger person like a child, advocating for their best interest by asking questions and getting answers that satisfy what you're looking for. Making sure you understand what type of surgery is being proposed, how it's going to be done, and what's going to happen afterwards. So there's a lot of responsibility on the patient to gather this information. Good surgeons, and most physicians, but really the best surgeons out there, in my opinion, are the ones that kind of answer all the patient's questions before they have a chance to ask them. I spend a lot of time basically telling people the good, the bad, and the ugly about surgery, you know, the benefits, the risks, how long it's going to take to recover, what's the realistic expectation for outcome, how much pain you're going to have after surgery, etc. Because that's my job. You don't know anything about the surgery. I know a lot about the surgery. And so it's my job to teach you about it. I think every surgeon should be held to that type of standard to satisfy a patient's informational needs. And then, you know, using your gut instinct to kind of say, gosh, I really like this guy or gal. I don't mean, every time I say guy, I grew up in California and we used to always say you guys for everything. Fortunately, here in the South, at least we can blend that to y'all, and it includes everybody. So I'm sorry if I offend, but because not all surgeons, and particularly not all surgeons at TOA are men. Okay, we have a lot of women in our practice, which I'm very proud of. But anyway, you know, getting that gut feel about I can relate to this person or not just trusting the reputation or not just trusting the referral is very helpful. There's some other areas where you can go to try to get some personal review rather than relying on an anonymous person on Yelp or Google or Vitals. Talk to your friends. Talk to the people who you go to church with. Talk to your family members. Ask them who they used. Why did they choose them? What was good about the experience? What wasn't good about the experience? If they have similar problems like you do, that can be very helpful in helping you to kind of make the decision for yourself about who you would like to invade your body with surgery to try to help your problem, okay? When I was talking to my friend about his surgeon, now he didn't choose somebody here in TOA, and it was interesting, and it didn't bother me, and I knew the reason why, but he had had some problems with his hip before and had surgery before by a different group in town. And he had a good relationship with that doctor. And he'd seen that doctor for a long time, and they became friends. And then when it was time for my friend to have a hip replacement consultation, that doctor referred him to one of his partners in his group. Well, my friend didn't know any better. He didn't really think about looking elsewhere. And so he felt good enough with the experience that he went ahead and scheduled surgery. And it just so happened we went riding about 3 days before his surgery, and he was clearly a little bit concerned about, did he rush into this too quickly? Did he make a good decision? And fortunately, I was able to tell him a significant amount about his particular surgeon and how good he is. So he's recovering. He's had a surgery. He's doing extremely well. He's had a great experience with his surgeon. And even though it wasn't a TOA doctor, I'm extremely pleased that my friend had a good experience with somebody in my profession. I have a lot of respect for his surgeon and the group that surgeon is involved with. And so I had no hesitation to say, you know what, you're in really good hands. But it's important to ask the questions. So again, healthcare in this particular situation, musculoskeletal, orthopedic, bone, muscle, joint types of problems, most of the time is not emergent. It can be urgent, such as a broken bone or a torn ligament or a ruptured disc, but most of the time it's not emergent. So you have the ability to pick and choose and fine-tune your choices. And remember that we don't have all the answers, and not every doctor knows everything. And so some people have different experiences with different areas of the body, or even particular subjects within that area, than other people. And that just comes with time and experience. And so while you may see two people that have very similar training, they may have subtly different ways of approaching a problem, or they may have different experiences approaching a problem. So it's very worthwhile for you to look into second opinion if you'd like. Don't feel weird about that. My piece of advice is, if a doctor gets offended by you asking for a second opinion, he or she may not be the one you want to be dealing with. I'm just saying. Lastly, a couple of terms. When we train, we go through residency. We often go through a fellowship for that subspecialty training. We are physicians, MDs. We've graduated medical school before all that training. There is a term known as board certification that's actually a really important term. When a doctor is board certified, that means he's gone through an appropriate residency and possibly a fellowship. He's had the appropriate amount of training for that specialty, and he or she has passed certain tests to essentially show their competence. In orthopedics, you can't get board certified right away. We start practice, we've finished our training, but we're what's called board eligible, meaning I am now doing practice, getting experience in order to support my request to become board certified. And we ultimately have to take an examination, an oral examination, and we have to keep up with written examinations in order to prove minimum competence in our specialty. And so what board certified means is that that person is now deemed competent in their area of specialty by the American Board of Orthopedic Surgery. It doesn't mean that the doctor's not nice or nice. It doesn't mean that the doctor is the best surgeon in the world, nor does it mean that he's the worst surgeon in the world. What it does mean is that we've achieved at least a level of competence in knowledge and experience to be able to be a practicing physician. So if you deal with somebody wherever you are orthopedics wise, it's pretty rare to find somebody who ultimately is either not board eligible or board certified. But if somebody's been in practice for a while, over 2 years, and they're not yet board certified, you need to know why. Now, there are extenuating circumstances. Sometimes people don't pass the exam on the first try, and that's understandable. You get nervous. I mean, it's a nerve-wracking kind of situation. But, you know, in my experience, if you've got somebody who's been in practice for 10 years in some small community or something like that, and they're not board certified, they don't really meet the minimum standards of expected in the larger society. And it's something to think about. Again, doesn't mean that they're a bad physician, but it's something to consider when you're evaluating your needs. Anyway, so to wrap it up, picking a surgeon is important, especially when you're talking about invasive procedures like surgery. You have a choice. Again, some insurance companies require a referral, most do not anymore. Working within your network is really the goal, so that you get the best insurance benefit for your care. Interviewing the physician as you would interview a carpenter to work on your house, or an electrician to add some electrical to your garage, you can interview your surgeon too. And use that kind of gut feel, that personal review with your friends and relatives, online review of their experience and background to help you make that decision. I mean, you can talk to your primary care doctor. They have a lot of experience with varying surgeons. So it's not just go where they tell you. You have the responsibility to look out for yourself and loved ones as well. It's a team effort. We're all trying to get to the same goal primarily, But again, people do it different ways. So I hope that this has been a little bit helpful to kind of give you some perspective from my seat about what I think patients should do, what's wise for patients to do with regard to treatments. And I hope that in my practice I'm able to give folks enough information to make a good, solid decision so that we can get them the help they need to get their lifestyle back the way they want it and improve their function in daily life. So that's it for today. So next week we have, thank goodness, been able to reschedule Dr. Ryan Snowden, who's one of my young colleagues. He started with us about 1.5 years ago, almost 2 years ago. He's a spine surgeon, and he's expert in spinal deformities, so scoliosis and kyphosis, these curvatures of the spine, both in the adult and in the child. So I'm looking forward to speaking with Ryan. He's a great guy. He's a superb surgeon. I've operated with him, and he has hands far more skilled than his years of experience would suggest. And I'm really looking forward to the topic. I know a lot of people have expressed an interest of rescheduling it when we had to reschedule because of the COVID-19 pandemic issue. So that'll be next Friday at noon Central Time here, Facebook Live. Again, if you have any questions, if you have any topic ideas, why don't you get on the comments and we'll get to those. I'm happy to answer any question I can. If I don't have the specific answer, I'll find you an answer. You can go to TOA.com. That'll give you an idea about our office, our practice, our locations, our physicians, what our services are. We do continue to open our offices in a realistic way under the CDC guidelines and the regional and statewide guidelines to try to help protect our patients from spreading this COVID disease. So again, be patient with us, be patient with one another. Look forward to seeing you in the office if we need you, if you need us. Not we need you, well, we need you too. But look forward to seeing you in the office if you need us. And until then, go out there and live your best life.